This is assignment 4 in advanced clinical procedures. Please select a slide background and ensure that your font color is legible. This periodontal charting will be used as an example for assignment 4. Note that a brief dental and medical history is provided. This is a basic example of how the American Academy of Periodontology classifies patients, which differs greatly from the American Dental Association's classification. To review, the AAP takes many things into consideration as periodontal history, medical conditions, and medications to define a patient's periodontal status. In this periodontal chart, we can determine that the ADA classification is a generalized class 3 with localized class 4. The 7 mm pockets documented in teeth numbers 3, 15, 19, and 30 present with severe periodontal disease in 14% of the dentition. Class 3 periodontal classification dominates over the remaining areas. Class 1 and 2 furcations exist in all quadrants, which aligns with the patient's ADA classification. Bleeding exists in almost 70% of the dentition. In the dental history, number 3 presents with an existing periapical abscess, and on tooth number 31, a pericoronal abscess is documented. The patient suffers from lupus, which is an autoimmune disease. Select the appropriate descriptors for your patient's AAP periodontal classification based on the information provided in the periodontal charting and brief medical and dental history. Gingival disease category 1A and 1B have both been selected. Due to the high percentage of bleeding points, we are assuming that bleeding is in response to poor oral hygiene. This coincides with the ADA's Class 1 classification. AAP 1A is selected. The AAP takes into account the patient's systemic disease and possible medication effects on periodontium, and provides an even deeper assessment as to why the patient's bleeding level is high. AAP 1B has also been selected. As in conjunction with the ADA classification, the AAP also recognizes chronic periodontal disease. However, unlike the ADA, the AAP uses the clinical attachment level to determine periodontal status. Clinical attachment levels document recession and bone loss. This measure takes into account historical bone loss that is present, as well as the current periodontal pocketing that is active with periodontal disease. When including the clinical attachment level in a periodontal evaluation, the disease becomes more severe. In the periodontal charting used for this assignment, recession has been measured and documented, but the clinical attachment level is not in the slide. Due to space constraints, it was excluded. With simple addition, the assessment can be determined. For this patient, chronic and aggressive descriptors have both been selected. The extent of the disease is both localized and generalized, and severity is based on clinical attachment level, which is documented as moderate and severe. The statement for this category will read as, the patient presents with generalized chronic periodontitis existing in 56% of the dentition that is moderate in severity. Localized areas limited to teeth numbers 3, 14, 15, 19, 20, 30, and 31 present with aggressive severe periodontitis, which constitutes 25% of the dentition. Due to the nature of the deepening pockets in the systemic health, the category rapidly progressive has also been selected. In category 3, we also have a specification for children and adolescents with an aggressive periodontitis that is only selected when patients fit into this age group. We are also basing our periodontal assessment on the patient's medical condition. They suffer from lupus, which is a systemic disease. An abscess of the periodontium has been documented in the patient's overview. Therefore, category 6 has been selected to represent the pericoronal lesion located on tooth number 31. The last category that applies to our patient is category 7. This category takes into account an endodontically involved tooth that presents periodontally. The final AAP classification is listed in the last column on the table. The patient presents with gingival disease. Category 1A and 1B have both been selected. due to the patient's poor oral hygiene and autoimmune disease and medication. Chronic moderate periodontitis, generalized to 56% of the dentition, has been documented, with localized areas of severe aggressive periodontitis limited to tooth numbers 3, 14, 15, 19, 20, 30, and 31. Systemic disease is also related to the patient's periodontal condition due to the systemic disease lupus. The absence of the periodontium is located in number tooth 31 with a pericoronal abscess, and an endodontic lesion does exist on tooth number 3.